This is Maggie Mann with Southeastern Idaho Public Health, and I'm here today with Leslie Talbot, who is one of our fabulous public health nurses. Leslie works primarily in Bear Lake County and Caribou County, but also throughout our district, providing services, working with immunization providers, and also providing immunizations herself. So, Leslie, thanks for being here today. We're here to talk about a really important topic, and that's childhood immunizations, something about which you are a true expert. You've done this for how long now?
23 years.
Yeah, so Leslie knows everything there is to know about childhood immunization. So, all parents, we want to do everything that we can to make sure that our kids are healthy and thriving, and parents tend to have a lot of questions about immunization. So we're so grateful for you to be here and share what you have learned in your experience as a public health nurse. So we'll just get started.
Okay, I'm happy to be here.
Leslie, what are some of the benefits of childhood immunizations?
Well, like you said, parents want to do everything they can to keep their kids healthy, and vaccinating them against vaccine-preventable diseases is one of the ways they can do that. And while sometimes these diseases can be mild, sometimes they're not, and they can lead to complications that can cause serious health problems in the future.
Right.
And, besides protecting the child, it also protects those around the child. So, like babies that are too young to be immunized yet, or people that are immunocompromised and because of that maybe can't take the vaccine or, don't respond as well to the vaccine. And the more people in a community that are vaccinated, the better the vaccine works, kind of that herd immunity concept.
Right, that's something that we've heard a lot about the last couple of years.
And, sometimes these diseases can lead to hospitalizations, which is, stressful, and medical costs, time away from work for the parents, or the child's school age time, out of school. So just preventing those kind of things too.
Okay. So when we talk about vaccine preventable diseases, what kinds of diseases are we talking about?
Well, I was just going to talk about some of the diseases we vaccinate against and, the complications that can arise from those diseases. So we give children DTaP vaccine, and then, once they turn past 7, we give the Tdap, but they protect against the same diseases, diphtheria, tetanus, and pertussis, or whooping cough.
Okay.
So, I think everybody kind of knows about tetanus or lockjaw, sometimes they call it. It's in the environment, in the soil. And, if you get that disease, it can cause a painful stiffening of the muscles, that can eventually, if it stiffens the muscles that help you breathe, can lead to problems breathing or even death. Diphtheria is a bacteria that can also lead to difficulty breathing, heart failure, paralysis, things like that. The pertussis or whooping cough, it just causes that violent coughing, and so sometimes it's, more dangerous for babies and young children, and they can really struggle with that cough. Can, also just lead to pneumonia, convulsions, brain damage, things like that. So
pretty serious.
Yeah. Like some of these diseases, some people have mild illness, but some people have more serious illness. You just don't know, who that's going to be. We vaccinate against Hib, which is Haemophilus influenza type B. It can cause a lot of different kinds of infections. Again, it can be mild illness like ear infections or bronchitis, but can lead to serious illness like blood infections and stuff. Hepatitis B is one we vaccinate against. It's a liver disease that sometimes is a mild illness, that can cause fever, fatigue, loss of appetite, jaundice, which is kind of a yellowing of the skin.
Okay.
And, most people clear it, but some people become chronic carriers, and then later in life, it can lead to liver problems, liver disease, or liver cancer, things like that. So, polio, I'm sure everyone's heard of that. Again, some people have mild symptoms like sore throat, fever, tiredness. But then for some people it can lead, infect the spinal cord, and then you can have problems with paralysis and things like that. So we vaccinate against pneumococcal disease, and that bacteria can cause numerous different, infections, pneumonia, sinus infections, ear infections. Again, sometimes mild illness, but for some people, it can infect your brain or spinal cord, leading to meningitis, blood infections, things like that. So.
Okay.
Rotavirus is one that causes kind of a severe watery diarrhea in infants. And a lot of times it can lead to hospitalization because they get so dehydrated.
Sure.
So, the MMR vaccine protects against measles, mumps, and rubella. Probably, most people remember those diseases. The measles can lead to a rash all over the body, and sometimes that can also just lead to those serious side effects like, pneumonia, brain damage, things like that. The mumps, causes the big swelling under the ears of those glands under the ears, the salivary glands. And most people do okay, but it can lead to deafness, swelling of the brain or spinal cord, painful swelling of the testicular ovaries. And then all of them can, in rare cases lead to death. But
okay.
If a pregnant woman gets rubella, that's dangerous for a pregnant woman. Can cause miscarriage, or if the baby is born, can lead to birth defects. We vaccinate against varicella or chicken pox, which is kind of a rash all over the body. Most people probably remember chicken pox, which again can be a mild illness for some, or it can lead to more serious problems like skin infections, pneumonia, inflammation of the blood vessels, swelling of the brain, things like that.
So as I listen to you talk, Leslie, one question that comes to mind is, do we really even see a lot of these diseases still in the United States?
Well, because we have such a robust, vaccination program in the United States, once we started vaccinating against things like measles and mumps and rubella, the rates of disease did go way down. And so they are, not as common in the United States anymore because of our vaccination program. But the bacteria and the viruses that cause these preventable diseases aren't gone. In fact, in some parts of the world, they're still prevalent. And, we're a mobile society.
Yes.
People travel. So all it takes is somebody to travel to another country, catch that disease, come back into their community, and you can, have an outbreak, especially if the vaccine levels are low.
Right.
If you have a good vaccination level, hopefully that won't happen. So,
yes.
Yeah. So if it gets too low, it could come back at any time.
So are vaccines safe for infants and children?
Yes, they are. So the United States right now has one of the safest and most effective, our vaccines are the most safe and effective they've been in history. And vaccines are held to a rigorous safety program. I mean, I read that most vaccines are researched for an average of 15 years before they're, released out to be used in the general public. They test them in volunteers, and they follow them for usually at least a year to assess for safety and also efficacy. And then even after we start using the vaccines, they're still monitored continuously.
Absolutely.
And if any safety problems arise, they will catch on to that and assess it further. So they are safe.
So they're safe. How common are side effects for vaccines, and what kind of side effects are common?
So like any medication, you can get side effects from vaccines. The most common thing is just a little bit of redness or swelling at the injection site. And just, we usually just tell parents to put a cool wet cloth on it, and most side effects resolve within 24 to 48 hours. I mean, some kids might get a little fever, fussiness, loss of appetite, things like that. And we just tell them kind of same thing, just treat the fever, dress them lightly. You can give fever-reducing medication like, ibuprofen or Tylenol. And again, they should resolve within, 24 to 48 hours. And serious side effects like an allergic reaction or something is very rare. Very rare. And and our staff are trained to deal with that if it ever did happen. So
I've heard some people say things like, well, I'm worried that there's so many vaccines, it's going to overload my baby's immune system. What are your thoughts about that?
Well, yeah, I hear that too. And on any given day, a baby is exposed to just numerous germs through the food they eat, the air they breathe, the things they pick up and put in their mouth. And their immune systems are designed to handle thousands of germs. And actually, babies' immune systems work very well, better than older children and adults. And so they say even giving them a vaccine, several vaccines with those antigens, it uses less than 1% of their immune system to mount a response. So
Okay.
You know, and there's risks choosing not to get the vaccine because you're leaving them vulnerable to those diseases. So
Absolutely. So the benefits definitely outweigh the risks.
Yep.
Okay. One real specific concern that has been very prevalent in some groups of people is that concern about vaccines leading to autism. Can you talk about the validity of that concern?
So I think this started like back in 1998 when a British journal article released an article that kind of said there was can I do this one over?
Yes. Yes.
I know what I want to say and it came out all funny. Oh my gosh, and then my phone rang. We really need to.
Perfect time for it to go though, right?
We really need to do it over. I'm sorry, did that mess you
That's
up?
okay.
Okay.
No,
All right.
You just start that answer over
Okay.
again.
So in 1998, a British journal article made a claim that there was a connection between the measles vaccine and autism. And it was a very poorly designed study with only like 12 kids.
Mm-hmm.
And since that time, I mean, the doctor that put out the article has had his medical license revoked. The journal article has, taken back what they said. And so they've tried to repeat that study with good studies, like with hundreds of thousands of kids, and they have never been able to repeat that. And so, I mean, kids that are vaccinated and unvaccinated develop autism at the same rate. And like I say, we've just done a lot of, people have done a lot of really good, robust studies that involve a lot of kids and just have never been able to repeat those findings. It just wasn't a well-designed study. And
So with all the actual things parents have to worry about, this isn't one of them.
no.
Okay.
Scientists agree that vaccines do not cause autism.
Okay. And what about people who want to follow like a non-standard immunization schedule for their kiddos?
Yeah, and we do have people come in that want to do that. And I mean, vaccine recommendations are determined after extensive studies. And that's one of the things they study is, how vaccines work together. Are they effective if you give them together? Are they safe if you give them together? And, all the research agrees that it is safe. And again, the decision not to vaccinate is, kind of making the decision to leave your child vulnerable to those diseases. And so they really try to get them in as soon as they can, because the point is you want to have them vaccinated before they're exposed to the disease. And then sometimes too, when you spread out that schedule, it's, it's more office visits, so it's more time for the parents.
Mm-hmm.
It's kind of more stressful for the kid because it's so many visits. It's not as cost effective. You're paying for doctor's visits. And then there's always a chance when you spread it out into so many visits that they just don't complete the schedule, too.
Sure.
So.
And then they're not as effective as they could be if they got every shot in a series.
Yeah. And like I said, they study them and they're safe together and they,
Okay. We've talked a lot, Leslie, about infants and children. What about adolescents? Do they need vaccines?
Yeah. So there's basically 3 vaccines we give in adolescents. So usually at the 11 to 12-year-old visit, we boost their, they had the DTaP when they were young, but we give a Tdap booster because through the years that immunity can wane. And teens are common transmitters of the pertussis virus, so we just boost them. And then also the tetanus. And in fact, you get a tetanus every 10 years, throughout adulthood. So we give that first booster at the 11 to 12-year-old visit. And then we vaccinate against meningitis.
Okay.
And like any age child can get meningitis, but it tends to be more dangerous in the, the teens and young adults. So that's kind of when we start that. We give, at the 11 to 12-year-old visit, we give a meningococcal vaccine that protects against 4 strains.
Okay.
And then we, the ACY and W, and then we give a booster at 16 to 18. And then there's another vaccine for meningococcal B that we start at 16 to 18.
Okay.
And, teens just tend to be more susceptible because they're in close contact and doing things and, things, sneezing, coughing, just being in close contact. In fact, they've found that like in dormitories when they go off to college, there's a little increased risk of meningitis because of the close quarters. So it's a good idea to have them vaccinated before they head off to college too, is another reason.
Okay.
And then the HPV vaccine, is transmitted by sexual contact. So you want to get the vaccine in and completed, before they ever have sexual contact. And there is some evidence they respond better at that preteen
Okay.
their immune systems respond better, and it's a time they're being seen by their doctors. So we just get that one started too, so that it's in and complete, long before sexual activity.
And that one's so important
Yes.
because that virus is a leading cause of cervical cancer
yeah.
for women, and also a leading cause of oral cancer in men.
Mm-hmm.
So if we can prevent a form
Yes.
of cancer from happening, then that is definitely the way to go.
Mm-hmm.
What about flu shots, Leslie? When should we start giving flu shots to kiddos?
So flu shots are recommended for anyone 6 months and older. So
Okay.
once they turn 6 months, we can start the flu vaccine.
Okay, and then every year after
Yep,
that.
every year after that.
Okay.
When they're a baby, they get 2. They get 1, and then they get a booster after 4 weeks, since it's the first time they're getting it. We do that up to age 9, and then after that, 1 time, and then after that, it's just once a year.
Okay.
Yeah.
All right. Well, Leslie, thank you so much for sharing your expertise and your knowledge with me and with everyone who might be viewing this. I'm so grateful for that, and great information for parents out there to have a better understanding of childhood immunization. So thank you so much.
Thank you.
And for everyone out there, thanks so much for tuning in. Until next time, be well.